One of the most expensive campaigns in Montana this political year is over Initiative 185. That's the measure that would raise tobacco taxes and make permanent Montana's expanded Medicaid coverage for poor adults. The airwaves statewide have been blanketed with ads financed by the tobacco industry opposing the measure. MTN's chief political reporter Mike Dennison tonight takes a closer look at the numbers behind those ads and the contents of Initiative 185.
You've probably seen or heard the anti-185 ads that say the initiative supporters aren't telling the truth about what it actually does. Here's an excerpt.
185 is a massive new tax increase that deceptively claims to fund Medicaid expansion, but doesn't provide enough new revenues to pay for it. So instead of fully funding Medicaid expansion, it creates a permanent unfunded mandate of $34 million a year that you'll have to pay for.
Medicaid expansion, which provides health coverage to 96,000 low-income adults in Montana, is set to expire next June. If voters approve I-185, the program is extended indefinitely. I-185, if passed, would earmark $26 million a year of the revenue it generates for Medicaid expansion. But the state's spending on the program is projected to be about $60 million a year, thus the $34 million unfunded mandate. Supporters of I-185 argue this unfunded mandate doesn't really exist. They say expanded Medicaid also saves the state $31 million a year by providing a better federal match for people that would be covered by Medicaid anyways, and that another $5 million will be paid each year in small premiums from people covered by the program. Together, these savings essentially erase any shortfall, they say. The ads against I-185 also don't mention that Medicaid expansion brings more than $500 million of federal money into the state each year that pays medical bills for thousands of people and creates jobs. Yet the ads against 185 note correctly that a lot of the money raised by the initiative go to programs other than Medicaid expansion. If approved, I-185 would raise taxes on a pack of cigarettes by $2 and by 67% on other tobacco products like moist snuff. Nearly one-third of the revenue from these higher taxes would finance existing programs like the Children's Health Insurance Plan, state building construction, and operation of state veterans nursing homes. 1/5 of the money, $15 million a year, just goes into the state treasury with no earmarks. And another $10 million a year goes to 3 new programs: services for veterans, including anti-suicide efforts, smoking prevention, and in-home services for elderly people with low income. So, as you can see, 185 is about more than just Medicaid expansion, although making that program permanent would be a significant step for Montana. Reporting from Helena, Mike Dennison, MTN News.
Thank you, Mike. The campaign for and against Initiative 185 has already topped $11 million. That includes money raised by both sides. 2 tobacco firms alone, though, have contributed nearly $9 million of that total.